Hello, my name is Dr. Farman Ali and I am a GP family physician. Today I wanted to talk about cancers. Cancers is one of the leading causes of mortality around the world. The important thing about cancers is to detect them early, and that can only happen if we all contribute towards early diagnosis. How can this happen? This is between the patients and their doctors. The patient, if they report their symptoms early to the GP or their doctor, and also if the GP or the doctor, no matter what specialty they are, if they come across any suspected cancer, they should refer them for further diagnosis, further investigations. So, we'll go through the cancers one by one, and I wouldn't bore you too much with the signs and symptoms of these cancers. However, I will be pointing out the key features which requires further investigations. So, first, the most important one is breast cancer in females. So, when do you refer a female for a breast cancer investigation? Anyone that you see with a discrete hard lump. It might be fixed or it might be mobile. There might be skin tethering with it. So in short, anybody above the age of 30 or older with a discrete lump that persists after a period or menopause then has to be referred further for investigation. Any patient that presents with spontaneous unilateral, which means one side discharge from the nipple, which may be blood stained and can soil the clothes. If the nipple is retracted or distorted in any way, and this is a new symptom, somebody who just noticed it in the past 3 months. Any patient that has got a skin distortion outside the nipple area, a tethering of the skin, or any persistent ulceration of the breast. Also, please don't forget unexplained lumps in the armpits or axilla. They need a further investigation. There are some other cases which you may or may not refer. However, they may present into your clinics. Women under the age of 30 with a lump, they are usually not cancers. However, they would need review. Asymmetric nodularity or thickening that persists after menstruation. They would need further investigation. However, unlikely that they are cancers. Patient with persistent breast pain with no palpable abnormality, refer them as a routine referral rather than an urgent one. Infections or inflammations that fails to respond to antibiotics, that requires further investigation. However, it might not be an urgent referral but a routine referral. Unilateral eczema, which means one-sided eczema or roughened skin of the areola or the nipple, that needs further investigations, but you may like to start them on some topical steroid creams. A one-sided spontaneous nipple discharge that persists or is troublesome. Remember, this is a non-bloody discharge, so that may require further investigation. This was about female breast cancers, but don't forget, breast cancer can happen in the males as well. So which male patients would you refer? Again, any male presenting with a discrete hard lump, which may be fixed or it might be mobile. It may or may not have skin tethering to it. You need to refer further for investigation. Any male presenting with a blood-stained discharge from one nipple, that needs further investigation. If the nipple is retracted and it is of recent onset. Any patient who has got some skin distortion in the breast tissue, tethering of the skin, or ulceration. These require urgent referral to the breast clinic to rule out cancer. There might be some other symptomatic patients. However, the cancer may not be the leading cause for it. However, these patients do require further investigation, and you should investigate underlying cause. For example, gynecomastia, which means the enlargement of the breast tissue in a male patient. If there is an eczematic skin around the areola, which is the brown area around the nipple, you may like to try some topical steroids before considering further referral. A one-sided non-bloody discharge from the nipple, which is troublesome, requires further investigation. In males, if a patient presents with an unexplained lump in the armpits or axilla, that requires further investigation with blood tests and other things. However, it may not be the sign of breast cancer. Now we move on to the next type of cancer, cancer of the brain and its associated structures. So what are the symptoms that requires further investigation? Somebody who has got a neurological deficit, which means that there is a progressive worsening of their symptoms. Somebody with a cranial nerve palsy, which means one of the 12 nerves that come out of the skull and that is paralyzed, or the area that it supplies shows any symptoms. Any patient with a new onset of fits or seizures, they need further investigation. Recent behavior change in patients is a red flag sign. Now, one of the most common questions that the patients come with headaches and they ask whether they have got a brain tumor. Yes, headache can be a sign of brain tumor. However, these headaches would usually show signs that the fluid around the brain has increased in pressure, and the patient may have the headache worsened by coughing or lying down. They may present with double vision, nausea and sickness, intermittent drowsiness, recent behavior change associated with headache, or any focal neurological symptoms such as a limb or arm not working, or whether they have any sensory deficit in those areas. If these symptoms are associated with a headache, these patients need further investigations. Now, on examination in a brain tumor, you might find that a patient may have impaired mental functions. They might be confused. There might be facial weakness on one side or both. There might be abnormality of the eye muscles. They wouldn't be able to move their eyes correctly. There might be sensory loss. They cannot feel sensation in certain areas. The limbs, they might have altered gait. If there is a problem with their cranial nerves, the doctor may look into the back of the eye and do a fundoscopy. And if they feel that there is a swelling called papillar edema in the back of the eye. Remember, one of the most commonly missed condition, unilateral deafness. One-sided deafness is a red flag sign and it does require further investigation. Dysphagia, hemiparesis, which means one-sided weakness, or any other neurological deficit. Another thing important to remember about brain tumors is that if a patient has got another primary cancer which is suspected to spread to the brain, you may require a further investigation, such as lung cancer, bone cancers. They might spread to the brain and it might be secondary rather than a primary brain cancer. Cancers in children are not a common occurrence. However, it is not impossible, and always have a high level of suspicion if you see any of these symptoms in a child. A bone swelling may be a sign of bone tumors. Behavior change in children, deterioration in their performance at school might be a red flag sign. Children who are fatigued, are lethargic and have no energy at all might indicate a sign of brain tumor. Neurological deficit such as new onset seizures, weakness, swallowing difficulty, facial weakness, or unsteady gait. They might be signs of brain tumor. Any pain in the bones, in the tummy, or persistent headaches are red flag signs. If the child appears pale or anemic to you, or they bruise easily, they need further investigations. If there is parental concern about suspected cancer, especially with family history. Persistent itching of the body, unexplained bleeding from anywhere, weight loss, which is documented and monitored. Or if they have another type of cancer, they would require further investigations. If the child has got any abnormality on the blood tests, you need to refer them as urgently to rule out acute leukemia, which is common in children. Gynecological cancers. It is very important to recognize the symptoms early because some of these symptoms can be easily missed. For example, if we talk about bleeding from the vagina, this happens normally in all women of childbearing age from the time they reach menarche all the way to menopause. However, some of these bleeds can be abnormal. Any woman that is bleeding in between the periods, if the woman presents with bleeding after intercourse, called postcoital bleeding, and any woman that presents to you after she had reached menopause and had no bleeds for some time and then represents, these are red flag signs and they need further investigation. On examination, if you find that there is a fluid, also known as ascites, in the abdomen, and if you feel an abdominal mass on examination, obviously not fibroids. If there is a history of fibroids, you will not refer, but any other masses needs further investigation. Postmenopausal bleeding also includes those under the age of 55. If the patient is examined and the cervix, which is the neck of the womb, appears consistent with cervical cancer, this may be during her routine smear examination or examination for another reason. If the pelvic ultrasound is reported as suspicious, please refer. Vulva is the area around the vagina, and if there are unexplained lumps, ulceration, or bleeding in that area, that needs an urgent gynae referral. Although abscesses are common in the vaginal walls, however, if there is an unexplained palpable mass in or at the entrance to the vagina, that needs further investigation. Endometrial thickness, which means the lining of the womb is more than 4 mm in a woman after menopause, requires further investigation. as it could be a sign of cancer of the womb. We move on to the hematological cancers, which means blood cancers. There are three different types. Either it could be leukemia, a lymphoma, or a myeloma. Now, a patient that presents with an enlarged spleen or liver needs a further investigation. Any patient with unexplained bruisings or a small dots of blood, also known as petechiae. Lymphadenopathy, which means enlarged lymph nodes, or an enlarged spleen that requires further investigations urgently in patients between the age of 16 to 24. Patients above the age of 25, if they have unexplained enlarged lymph nodes. Again, if their spleen is enlarged, confirmed on ultrasound, they require further investigation. Myeloma is one of the cancers that is commonly missed. For that, you would need either urine or serum protein electrophoresis. You do a full blood count, use a knees and liver function test. And if these indicate proteins called paraproteins, then you need to refer them urgently. If a patient has no other cancers and they are showing any abnormality on the blood test, it's always advisable to discuss it with your hematology consultant. Cancers of the head and neck. Cancers in the head and neck region can happen in any of the following areas. It can be in the oral cavity, in the voice box called larynx or pharynx. It can happen also in the nasal cavity or the thyroid. So which patients would you refer for further investigation? Patients with a red or a red and white patch in the oral cavity, which is consistent with erythroplakia or erythroleukoplakia, which means white ulceration of the lesion. Any lumps on the lips or in oral cavity that are not related to the dental causes. If there is ulceration in the mouth that is lasting more than 3 weeks, that needs a further investigation. Anybody above the age of 45 with persistent hoarseness and normal chest X-ray requires further investigation. Persistent lumps in the neck is a red flag sign. If there is any swellings or masses in the eyes region or orbital mass, they would have bulging of the eye, that requires urgent investigation. Unexplained lumps in the thyroid gland, which is in the neck, requires a further investigation. If there is any signs of obstruction of the superior vena cava, which means the blood vessel in the neck, they feel obstructed, or if there is any stridor, which means difficulty in breathing, these are medical emergencies and should be sent immediately to the hospital on the same day. Do not wait for a referral. Cancers of the bowel, also known as lower gastrointestinal cancers, are common and they need to be treated early. Again, one of those cancers where the signs and symptoms can be very easily missed. So, which patients would you refer for further investigation? Any patient above the age of 60 presenting with iron deficiency anemia, they require a further investigation. Nowadays, in the UK, we have a fecal immunochemical testing, and that is a requirement for any referral when you are suspecting cancers of the bowel. It is good practice to do that early. If you examine the patient and you feel a mass on examination, you need to refer that patient early. This is also valid for colleagues working in other specialties such as orthopedics and other areas who may have to do the rectal examination for another reason. Abdominal masses that you cannot explain needs urgent further investigation. As mentioned earlier, fecal immunochemical testing can be positive either when it is requested by a GP or it came as a routine screening program. These patients need further investigation. Any patient above the age of 40 with an abdominal pain and unexplained weight loss. If a patient under the age of 50 with rectal bleeding and any of the following signs such as abdominal pain, a change in bowel habits, unexplained weight loss, or iron deficiency anemia. Any patients above the age of 50 with unexplained rectal bleeding when you cannot find hemorrhoids, anal fissure, or any other causes for their rectal bleeding. If a patient is above the age of 60 and they report a change in bowel habits which cannot be attributed to a change in medication or gastroenteritis and is persisting, requires further investigations with colonoscopy. There is no cutoff for the duration, however, it is dependent on the clinical judgment. Unexplained masses around the anal area or any ulceration in that area requires a further investigation. Let's talk about lung cancer. Still one of the leading causes of death in respiratory diseases. So which patients require further investigation for lung cancer? Any patient with a suspicious mass on chest X-ray will obviously require further investigation. They can include either lung cancer or mesothelioma. This is applicable to patients of all ages. Any patient presenting to you with unexplained hemoptysis, which is bringing up blood when they are coughing. Persistent or recurrent chest infections that are not responding to antibiotics. Chest signs consistent with lung cancers. If there is any signs of pleural disease. Remember, finger clubbing is an important sign and should be investigated early. A persistent enlargement of lymph nodes, either in the neck or just above the clavicles, also called supraclavicular, which is over here in these areas, needs further investigation. Thrombocytosis is a sign of lung cancer. Sometimes the signs can be much more subtle. So remember, if you have a patient who has smoked or has been exposed to asbestos in the past, and they present with either of these signs, such as persistent cough, fatigue, shortness of breath, dysphagia, wheeze, or any chest or shoulder pain, as well as hoarseness, unexplained loss of appetite, or unexplained weight loss, there may be an underlying lung cancer. And as I said, some of these signs might be very subtle in the early stages of the disease. If a patient has other cancers, it can spread to the lungs. So be suspicious of that and refer early. Sarcoma. Sarcoma is a cancer of the bone. They are commonly missed cancers, and by the time they are found, they can be quite advanced. However, if we practice caution, we can catch these cancers early. If the X-ray is suggesting the possibility of a bone sarcoma, such as spontaneous fractures, bone destruction, or soft tissue swellings, or any new bone formation, or if the lining on the top of the bone is elevated, called periostal elevation, that requires urgent further investigations. Unexplained bone swellings or pain should get a prompt urgent local X-ray. Soft tissue sarcoma can also happen, and if the ultrasound is suggestive of sarcoma, or if the ultrasound is uncertain but there is a clinical concern that it could be sarcoma, please refer those patients early. What are those clinical features? If there is a mass which is more than 5 cm, it is quite deep to the fascia, it is painful, fixed and increasing in size, or there is local destruction, these are usually the signs of soft tissue sarcoma. Skin cancers. I've covered this topic in a detailed presentation and it is available on our YouTube channel. Please feel free to go to the website or YouTube channel to download it. However, I will briefly touch upon some of the red flag signs. Any patients that presents with a suspicious lesion which has got either of the following 3 signs, such as a change in shape, an irregular shape or irregular color, they get scored 2 points each for these. Other features such as large diameter more than 7 millimeters, inflammation, oozing or change in sensation, give them 1 point each. If the total score is equal to or more than 3 and it is a pigmented lesion, it requires urgent referral to rule out melanoma, which is one of the type of skin cancers. If you see a lesion that is persistently bleeding and it has got ulceration and crater, and you think it is a squamous cell carcinoma in sun exposed area, that requires urgent referral. Pigmented or non-pigmented lesions that could be suggestive of nodular melanoma, which is raised above the surface of the skin. Or if you have the possibility to do dermoscopy in your clinic and you find that the lesion is suspicious of melanoma, that requires urgent referral to the skin cancer pathway. If a patient has got basal cell carcinoma, but it is on an area which can cause further complications such as the nose, the lip, or close to the eye, that requires an urgent 2-week referral to the skin specialist. Urological cancers or cancers of the urinary tract. These apply to both male and females. However, let's go through the male patients. If you examined a patient for large prostate and it felt malignant to you, which would be roughened surface or the skin attached to it, one side is larger than the other, that requires an urgent referral. You do not need a raised PSA level for that. However, if the PSA level is raised for their age, you need a further referral. PSA levels can be affected by the rectal examination. So it's better either to do the PSA levels before the rectal examination or give some time for the blood test. Remember, there can be false positives in there, and do warn your patient against it. Cancers of the bladder or the kidneys. If a patient of age 45 or more presents and they have unexplained visible hematuria, which means blood in the urine, without any urinary tract infection, they require further investigation to rule out the cancer. If a patient is above the age of 45 and they have got blood in the urine and you treat them for urinary tract infection, but the bleeding returns after successful treatment of the urinary tract infection, they require further investigation. Patients above the age of 60 with unexplained microscopic hematuria, which means that the blood is not visible to the naked eye, but it is seen on the microscope, and either of the two features is present, such as burning sensation when passing urine, called dysuria, or raised white blood cell count, they require further investigation. These can sometimes be missed when the urine results returned from the lab, because we commonly look for the bacteria and sometimes the white cell count. However, it is not unheard of that the red blood cell count is missed in the urine analysis. Cancer of the testes, a non-painful enlargement or change in shape or texture of the testes, requires urgent further investigation. An ulceration or mass which is not related to sexually transmitted infection on the penis is a red flag sign, and the patient should be referred for penile cancer to be excluded. Unexplained or persistent symptoms affecting the foreskin or the glands, that requires a further investigation. Cancers of the stomach and upper gastrointestinal tract require further investigations in the following patients. So if a patient is above the age of 40 and they present with jaundice, have a high suspicion for pancreatic cancer. If you examine the patient and you can feel an abdominal mass in the upper abdomen, that is usually consistent with stomach cancer. If there is an enlarged gallbladder, which you can feel under the right side of the ribs, you will feel a mass, and that requires urgent investigation. Patients who have enlarged liver require further investigation because it could be the cancer from the bowels spreading into the liver. Patients above the age of 60 with weight loss and presenting with any of the following signs, such as diarrhea, back pain, abdominal pain, sickness or feeling sick, constipation or new onset of diabetes, raises the suspicion of pancreatic cancer. Patients with difficulty in swallowing at any age requires an urgent endoscopy, which is a camera test in common words, to rule out any obstruction in the esophagus or food pipe. If a patient is above the age of 55 and they present with unexplained weight loss and they have got either an abdominal pain, persistent reflux or dyspepsia symptoms, they would require further investigation through endoscopy again. Patient above the age of 55 with nausea or vomiting and with any of these signs such as weight loss, reflux, dyspepsia and upper abdominal pain again require endoscopy. Remember, it's persistent nausea and vomiting in anybody above the age 55. Patients who present with upper abdominal pain and if they are above the age of 55 and their hemoglobin level is low, they would require an endoscopy. Patients above the age of 55, again, with raised platelet counts and any of the symptoms such as nausea and vomiting, weight loss, reflux or dyspepsia requires further investigation. Patients who bring up blood while vomiting requires further investigations. The only exclusions to that might be Mallory-Weiss tears. However, if this is unprovoked, then you need further investigation. Any patient above the age of 55 with a treatment-resistant dyspepsia, which means that you have given treatment for the dyspepsia and has not responded, requires further investigations. So this is all about cancers. Remain vigilant. Please refer early to save lives. Thank you very much.